The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
Remember a few months ago when Ontario suffered only about 100 positive COVID-19 tests a day? Well, those days are long gone. We're much closer to almost 2,000 positive tests a day now. And the holiday season is upon us. Is there anything public health can say to keep a lid on the mounting numbers? Tonight, we're asking two of the doctors in charge of the most populous parts of this province, both of which are currently in lockdown. Then, psychologist Kelly McGonigal explains the brain benefits of movement and offers some real inspiration for these sedentary times. It's Thursday, December 10th, and that's next on The Agenda. Between Ontario's capital city and Peel region just to its west, well more than 4 million people are now in the strictest level of lockdown to prevent the spread of COVID-19. Other areas also face tipping points for their healthcare resources. The second wave is taxing people, the economy, and most everything else, even as the first vaccine has been approved for Canada. Here to help us understand what's going on and what's ahead, we welcome, from the downtown core of the capital city, Dr. Eileen de Villa, Medical Officer of Health for the City of Toronto, and in North Toronto, Dr. Lawrence Lowe, who's Medical Officer of Health for the region of Peel. And we're really grateful to both of you two for joining us. I know how crazy your schedules are these days, so let's get right to it. There have been lockdowns in both of your regions since November 28th. Dr. de Villa, start us off. Can you yet tell whether or not these lockdowns are actually working?
Well, you know, Steve, we're starting to see some changes in the trends. We are seeing some effect. Are we seeing everything we want to see? No, we're not. We know that we're continuing to have high case counts, but we do know that what makes a difference is the degree to which people are able to interact with each other and to have close contact with each other. So to the extent that the restrictions are able to limit that and to remind people of the need to stay home as much as possible and to limit their close contact with those with whom they don't live, then we know that we are having some impact.
How about you, Dr. Lowe? What are you seeing?
Yeah, I would agree, Steve. Certainly, we're not seeing everything unfold completely perfectly, but we are seeing things start to level out. And we have to remember, you're not going to see a decrease right away. You've actually got to just stop the thing from growing in the very first place. And so to the extent that the measures have been put in place, to limit the opportunities for in-person interactions, to limit discretionary excursions outside of one's household, I think we're starting to see the effects.
Dr. de Villa, is there enough enforcement going on out there to make you think this could work?
Well, you know, it's interesting. There's always a lot of conversation around enforcement and the value of enforcement. But I think throughout the course of the entire pandemic, what we're seeing is most valuable are actually the choices that each and every one of us makes for ourselves and for our families. There will never be enough of enforcement in any jurisdiction to manage all the behaviors that happen in any given city or region, in the case of my colleagues at Peel. What it comes down to are the choices that each and every one of us makes, and we can choose to do the best we can to protect our health, the health of our families and those around us that we love and care for, or we can choose alternatively. We've seen the ability of people to choose correctly, to reduce their interactions. We've been successful before in reducing the spread of COVID-19, and we're counting on the people of Toronto, and I would dare say in the case of Dr. Lowe, on the people of Peel, to do the right thing to help us bring these case counts down and to restore, the kinds of, bring us back to the activities that we also cherish in our communities, get back to life a little bit more like we're used to.
I hear you on that, but let me do a follow-up in this regard. It wouldn't presumably take too many high-profile enforcement situations for more people to get the word. Just as in the case of that fellow named Skelly, who was opening up his store and selling stuff that he shouldn't have been, and then had tens of thousands of dollars worth of fines to have to deal with, and the locks changed on his business. What about a few high-profile cases like that, just so that your words would carry more weight? Are you for that?
Well, I think what I am for is for the appropriate application of enforcement. And of course, each enforcement situation warrants its own assessment, and one has to make the determination as to what makes sense in that circumstance. So certainly that's what we've seen when I've seen the work of our Toronto public health enforcement people, or whether it's my colleagues in bylaw enforcement here at the city, or Toronto Police for that matter. I have counted on them and have been able to rely on them to make appropriate determinations as to what they see, and make decisions around what is the best approach to bring about the outcomes that we're all seeking, which fundamentally is a safe and healthy community.
Dr. Lowe, I'm going to get you to react to this piece written in the National Post just the other day by Chris Selly, who wrote the following. Much as many Canadian experts and commentators argue for the sorts of lockdown measures that Europeans and Australians have endured, the fact is they are inconceivable here. Police ID checks, roadblocks, warrantless searches, mass arrests. In the case of Melbourne, literally confining thousands of people to their apartments for 2 weeks, 24 hours a day. Indeed, most of the people arguing for the Australian approach in the abstract would be appalled if many of its specific provisions manifested here. Do you agree with that, Dr. Lowe?
Yeah, I think it's really interesting, and I would actually be also keen to hear what Dr. Davila has to say about this, because I think the term we use in general is that we are threading a needle, and ultimately there are significant impacts and issues that arise if COVID-19 is allowed to spread unfettered in our community. But we also know that if we go too hard on the restrictions, that there will also be impacts to health, and ultimately, to the extent that we are trying to figure out the appropriate balance that allows us to get COVID-19 under control, but also addresses some of the other impacts to individuals' health and well-being, it's really important to look at any proposed measures to control the disease in all of those comprehensive lights.
Dr. Davila, the Australian approach here, what do you think?
Well, I think Dr. Lowe he put it quite nicely. It is about balance. And when it comes to public health, when we are thinking about any kinds of restrictions that we're placing on people's liberties, it's always a question of proportionality. We try to do only that which is needed to actually achieve the appropriate health outcomes, the healthy and safe community that we all want to live in. So to the extent that we can do that in a more balanced and a less intrusive way, that's always a better way from a public health perspective.
I don't know what you two are seeing in your email inboxes or the phone calls that you get, but I can tell you certainly on my end, what business would consider inconsistent approach to handling small businesses versus big box stores has really grinded a lot of people's gears, if I can put it that way. In particular for the small business folks who really make half their annual revenues in the month leading up to Christmas. They want me to ask this question. Do you two really have enough evidence to suggest that a significant portion of transmission is coming from people shopping in local stores? Because the impression I'm certainly getting is that when tons of people are crowding into these big box stores, they cannot be safer than smaller numbers of people shopping in smaller businesses. Okay, Dr. Lowe, you first. Go for that one, please.
Absolutely. And, listen, my heart absolutely goes out to small business owners. This is like any other natural disaster, really something that is ultimately impacting all of us, and particularly in a very negative way. I liken it, though, to just the fact that our situation has changed. It's not about where it's coming from or sources of spread at this point in time. In the region of Peel, we have significant and unsustainably high rates of community transmission. And ultimately, cases become hospitalizations. And regrettably, some of those that end up being hospitalized end up succumbing to this disease. And the more you have and feed into that cascade, the more you're going to see on the other end in terms of overstrained hospitals, capacity, et cetera. So to the capacity challenges, et cetera. So to the extent that we are trying to limit venues for in-person interactions and really sticking to just the essentials, That's why there is what is a seeming disparity, but just really trying to say, you know what, if there's no place to go, it's more likely that people are going to stay home and do the right thing to limit their in-person contacts.
And I get that position. And Dr. Davila, I know it's not your responsibility to make sure that the economy is humming. Your responsibility is public health. I do get that. But do you also appreciate the point of view of many citizens who've been in touch with me who say, this just doesn't make common sense. We can crowd into big box stores. We can't crowd, we wouldn't want to crowd. We can't do smaller numbers, properly, protocoled, if I can use that word, in smaller businesses. How does that make sense?
Well, I think what this boils down to, Steve, is this issue of the fact that it's not economy or public health. The reality is that we cannot have a strong and vibrant economy, and we don't have a strong and vibrant community without public health. So as Dr. Lowe rightfully points out, the point behind the policy now, what we are seeking to achieve through the policy levers that have been, deployed, is to actually reduce the likelihood that people are out and about and inadvertently mixing with each other or mixing with people who may have a COVID-19 infection. So to the extent that people are restricting their actions as much as possible, staying at home as much as possible, limiting their close contacts with those to whom, with their household, with the people with whom they live, that's the best way we can actually bring COVID-19 under better control, limit the impacts on our hospital system and our healthcare system writ large, and restore balance in our economy and in our communities writ large.
I do get that, but again, I am going to go at this again because help me understand why it makes sense for people to be able to go shop at Costco, for example, or Walmart, and spend as much time there as they want, with as many people in those stores as they want, but smaller stores have to close, even if they restrict, say, to 5 customers at a time. How does that make sense?
Well, I think that might be a question that's better addressed to our provincial counterparts. But I would say this. I think the issue is around, access to essential products and, the things like groceries and pharmaceutical products. These are the kinds of things that we recognize are essentials and that people need to have access to. But at the end of the day, what we are seeking to do here through public health measures is to reduce those interactions, to reduce the likelihood of ongoing transmission of COVID-19 by reducing the opportunities that people have to mix with those who are outside of their household.
No, I do get that, and you're quite right. Ultimately, it was a Government of Ontario decision that put this in place. So, however, it sounds like you agree with it. So, anyways, moving on. I've tried that one enough. Dr. Lowe, let's go to you on this one. There has been a great deal of talk in Brampton over the last several weeks, Brampton, of course, being a part of Peel Region, particularly during Diwali, when many people were getting together in large numbers at private gatherings, either before or after religious services, turning these gatherings into potential super spreader events. Can you confirm for us here that, in fact, a lot of transmission did take place in that fashion?
Absolutely. I mean, the reality is that Diwali aside, with every holiday, with every large celebration, we've actually seen cases where people are still congregating, still getting together, and resulting in transmission events. And that, if anything, actually gives us a little bit of pause with the upcoming holiday season. We have to remember that this is not a normal holiday season here in December, and we do need to continue to make sure that we are limiting our close contact as much as possible to the people we already live with under one roof, and outside of that to just make sure that we're only meeting in person for essential reasons. Because the reality is that with Diwali, but also with Thanksgiving, with Halloween, we did see in the region of Peel significant transmission. And in fact, it was the post-Thanksgiving surge that ultimately pushed us deep into our second wave.
Dr. Davila, can you help us understand now that we started off this by saying that it was at the beginning of the program, it's only a few months ago we were having 100 cases a day across the whole province of Ontario. Now we're up close to 2,000 cases a day, or positive tests a day, I should say. 2,000 positive tests a day in the province of Ontario. I get Diwali in Peel Region. I get restaurants. I get big box stores. Where are you seeing the biggest numbers of transmission, Dr. Davila, coming from right now?
So I think, as has been the case throughout the entire pandemic, what we are seeing is the major source of infection is close contact with other people. That's the primary mode of spread of COVID-19. And as you've heard, it is extremely unusual and frankly very, very difficult for us as social creatures to not want to congregate, especially on special occasions and celebrations. It is very natural for us, particularly under times of duress and stress, to want to be with each other. Unfortunately, that is exactly what promotes the spread of COVID-19. And so we have to fight our instincts and break with time-honored and really important traditions that many of us hold dear if we are to be successful in terms of combating the spread of COVID-19. That's one of the very challenging aspects of this particular pandemic.
Well, okay, let's get into this now because, of course, we are in the holiday season coming up. There are people going to be celebrating Hanukkah. There are people going to be celebrating Christmas. We've got Kwanzaa coming later in the month. Ismaili Muslims are going to be celebrating the birth of His Highness. Lots of different reasons for lots of different religious groups to get together right now. And okay, Dr. Lowe, give us your best advice on what's okay and what's not okay as the month continues.
Absolutely, Steve. I mean, I think in the region of Peel, especially with our continuing rates of community transmission, the advice is starting to look the same. It's essentially, at this time, hosting social gatherings or attending social gatherings is a high-risk activity for spreading COVID-19. And so I think people should be anticipating that, as with every other holiday that we've seen since the start of the pandemic in our community, it's going to have to look a little different this year. Really focus on limiting the close contact and celebrating with those that you already live with under the same roof, and then connecting virtually with others, definitely. I think that's just the way it's going to have to be.
Dr. Davila, I heard him say limiting. Does that mean absolutely verboten anybody who doesn't live in your home shouldn't come over to your home?
Well, there are some exceptions, and there's one in particular that I think is worthy of note. For those who live alone, we're asking that, in order that they have some togetherness and have that ability to connect with others, which we know is important from a health perspective as well, that they choose one other household to connect with. We don't want people to be alone over the holiday season. We know how difficult that is. The nights are long, the weather is cold. We don't want to worsen mental health conditions or leave people in a socially vulnerable situation. So those who live alone can connect with one other household. But other than that, as Dr. Lowe says, stay home as much as possible. Keep your social interactions restricted to those with whom you live. Connect with others virtually, remotely, phone, FaceTime, whichever your preferred method might be. And hopefully by next year, we will be able to have holidays more like we're used to, and ideally everyday lives a little bit more like what we've been used to in the past.
Well, you two are not going to be surprised that I'm going to want to drill down a little deeper on this as we go along here. Dr. Lowe, what about, because if that's one exception, I'm going to see if there are some other exceptions out there as well. Dr. Lowe, what about the notion that family A stays in its bubble, has followed all the protocols that you want, they're excellent at mask wearing adherence, they are physically distancing, they are washing their hands. That's house number one. House number two does the very same thing. Any issue with the two of them getting together, physically distancing, wearing masks, washing hands for an hour on Christmas Eve? Any issue with that?
Well, again, Steve, ultimately, I think our recommendations are recommendations, and it'll be up to people to decide, how best they can adhere to them, how best they can assess their own risk. And as you describe it, that situation, I mean, sure, it might be low risk, but I know people that have personally been touched by COVID-19. I know people who they followed all the rules, and yet COVID-19 still managed to visit them. That's just how insidious this virus is. So there's never any guarantee of certainty, and the precautions are the precautions, but they are by no means bulletproof.
Dr. Davila, I'm going to give you yet another example, and this one I think is even harder, and it's heartbreaking. I spoke to somebody today whose father is dying. He's got probably less than half a year to live. And the family understands that this will almost certainly be their last Christmas together. And they are protocol adhering people. And they are asking themselves, they are all asking themselves, both family and parents/grandparents, whether it's okay to get together for a couple of hours on Christmas Eve. Now, they know it's a risk, but given this man's circumstances, how big a risk is it really?
Okay, Steve. Well, I would say this. I think Dr. Lowe covered it really well. The recommendations are the recommendations. And, we trust that people have to make their own best decisions. There is no perfect 100% risk-free solution. That just doesn't exist. But I can tell you this, Steve. We had a recent loss within my family, and it was an anticipated loss. And I can tell you that we did follow the rules. We did not convene together in keeping with the rules. As difficult as that was, we found ways, to say our goodbyes, to express our grief, and to be together in that very, very difficult moment, while respecting the COVID-19 protocols. But I recognize that each of us has to make the decisions that make sense for our own unique circumstances. But at the end of the day, the advice still rests in the fact that the safest thing to do is to limit that interaction and to keep close contact limited only with those people with whom we live.
I really don't want to invade your privacy here, so feel free to tell me to get lost. But did you find that in spite of all of the tragedy you were dealing with, it was a satisfactory way to deal with the issue, considering protocol adherence, the need to be with this person, etc.?
Yeah, I don't know that there is ever anything satisfactory around the grieving process, Steve, to be honest with you. But, I felt that I was able and that we as a family were able to be supportive and supported by each other in that very, very important and delicate time.
Okay, understood. Let's talk vaccines. Dr. Lowe, Health Canada gave the Good Housekeeping seal of approval this week. When do you suspect we will start to see people with needles in their arms?
Well, Steve, that's a really great question. And as far as I know, from what we understand, we are being asked to start planning, or at least we've been planning for quite some time, obviously, but we've been asked to start anticipating that this is going to happen in very short order following the Health Canada authorization. And so I don't know. I think at least in our region, we're anticipating that many of our vulnerable populations, some of the guidance that's being issued by the provincial, in accordance with the guidance issued by the provincial government, maybe in a matter of weeks or months.
Oh, I gather, I've just been sent a note here by Cara Stern, who's producing this, that apparently the Premier of Ontario, as we speak, has said University Health Network Tuesday next week. So it's coming sooner than we thought, the first vaccines. Okay, here's the follow-up question for Dr. Davila, which is, you got to make sure this is done fairly. And I don't know what the definition of fair is, but you guys do and the politicians do, presumably. What does that look like to you? Fair, equitable distribution of vaccines?
Well, to my mind, it is a question of understanding how best do we roll out the vaccines in a manner that provides for protection, particularly for those who are most vulnerable and most sensitive to the negative outcomes associated with COVID-19. And in fact, what we've seen already is from the National Advisory Committee on Immunization and echoed by the decisions that have been taken thus far at the provincial level, that there are priority groups, thinking in particular of those who are older in our population, especially those that live in congregate settings like long-term care homes, the staff who take care of them, healthcare workers, and adults in Indigenous communities, as I recall, are amongst those priority groups, given what has been provided at the federal level and echoed by provincial advice as well.
And let me just follow up in this regard. Once you get your 2 shots, if that's what it takes, once you get your 2 shots, Do you still have to wear a mask and socially distance from other people and wash hands and all that stuff? Dr. Davila, what's the word on that?
Yes. So, in fact, while the vaccine is certainly providing a great deal of hope to many of us, it does not mean an end to those important self-protection measures, right? We still have COVID-19 circulating in our community. And even though we've got, we are soon to be having vaccine as one of the tools that's going to be deployed in the fight against COVID-19. It is not a silver bullet, nor does it happen overnight. So I think we can expect to see the need for ongoing self-protection measures for some time yet.
Okay. Dr. Lowe, any chance of you recommending a late return to school in the new year?
Absolutely. I mean, I think it's something that we're all going to be considering in our community context. So there's conversations and discussions really trying to see where the trend line is going to go in terms of our cases, what our hospital capacity is going to look like, testing as well, which is an important component of responding to cases or outbreaks that are identified in school settings. So all of these are considerations that are being discussed. And as for whether it's being considered, I can say, yes, it is. Certainly, we would want to work with our school board partners and with the Ministry of Education around any such decision that might be taken. And we'll make sure that we make whatever decision is made is certainly in the interests of continuing to protect the health and safety of students and staff and our community.
Okay. Dr. Davila, I got about a minute left here, and let me put it to you for this. The one thing, besides the small business angle, the other thing that I'm hearing about from our viewers and listeners more than anything else is frankly just how sick and tired they are of this whole thing. They get that they have to follow protocols. They just don't want to. They've had it up to here with COVID-19. They accept that the advice that you and Dr. Lowe are giving is accurate, but they've had it. So my question is, how are you really going to turn the corner on this thing when people have just had it up to here with COVID-19?
Yeah, that's $1 million question, Steve, no question. If it makes the public feel any better, we're tired too, right? This is not something that is unique or that public health physicians and public health staff are immune to. We too feel that pain. We're part of the community as well. But what I would encourage people to think about is we know we can do this. We have done it before. We have been successful in terms of reducing COVID-19 spread in the earlier wave of this pandemic. And now we are about to have vaccines join the toolkit of what we have available to us in terms of fending off COVID-19. And the more we are able to reduce the spread now by our own actions, the more effective we're going to have, or the more effectiveness we're going to have out of this new tool that's just about to, be unleashed on all of us and to help us in our fight against COVID-19. So I think that the more we can just hold fast, stay strong, recognize that it does work, because it is evidence proven. We know that distance works. We know that vaccine will add some extra punch to our fight. And if we can just hang on a little bit longer, we will soon get back to the kinds of lives we'd like to have and get back to life as we knew it.
As they say, from your lips to God's ears, and I'm not sure how much of a Christmas break either one of you two are going to get. I hope you get a little one, and at least a little one. And we always are grateful that you take our calls and come onto TVO and share your information with us. So appreciate it very much. Eileen Davila and Lawrence Lowe, the medical officers of health for the City of Toronto and Peel Region, respectively. Thanks so much, you two.
Thanks, Steve.
Thanks.
If ever there was a time when the benefits of physical activity and exercise were advisable, now is it. But as many of us are all cooped up and a bit miserable, if you need some additional motivation, our next guest has it. Psychologist Kelly McGonigal's new book is The Joy of Movement: How Exercise Helps Us Find Happiness, Hope, Connection, and Courage. And she joins us now from Palo Alto, California, to explain. I have to start not only by welcoming you back, but also by telling you how impressed I am that just as we were setting this up, you said to me, I remember my last trip to the studio there in Toronto and I had such a good time. And I had to express admiration that you even remembered that. or you're very well briefed, one of the two. So thank you for starting that way. How you doing, incidentally?
I'm doing great, and it's great to be back.
I want to start with, actually, you know what? I'm not even going to go to the sheet on this. I want to start with, what time did you get up this morning? What time did you get a workout in? And what did you do?
Yeah, so I got up at 6 o'clock this morning, which is a little earlier than usual because I wanted to be able to get in a boxing workout before our interview. And boxing is something that I've been doing a lot of during COVID-19 because it's a workout that helps me tap into my fighting spirit. It makes me feel fierce and strong and powerful. And even though I'm not a morning person, I've learned to get up early enough to get a workout in before my day because of what I know about how exercise changes your brain chemistry and your outlook. And it really makes me a better version of myself. So, so I got up a little early for that.
I well remember back in 1992 when Bill Clinton was running for president, and James Carville, his political advisor, when asked what the election was about, he said, "It's the economy, stupid." And that was what everybody had to remember. And I set this next question up with that little story because I'm under the impression that everybody knows that exercise is good for you because it's the physiology, stupid, if I can paraphrase Carville. Exercise releases endorphins, and I know you say in the book there's way more to it than that, but why is there way more to it than that? Isn't that just it, case closed?
Well, so the physiology, the neurochemistry of movement actually is incredibly powerful. And it's beyond endorphins, by the way. So, we can talk a little bit about the exact chemistry of different exercise highs, but movement can release all sorts of brain chemicals that not only make you feel better, but that also help you connect with others, that produce courage and hope. So it is the brain chemistry for sure. And also, it's things like, we talked about how in movement, you can sense different aspects of yourself. You can sense your own strength. You can sense yourself growing and learning. There's also the communities that form around movement. So many people form support networks through recreational sports or classes at the rec center or running groups. There's a lot to why movement makes us happy, and it's everything from the brain chemistry to how you feel about yourself when you challenge yourself physically and you learn what you're truly capable of.
Well, do you want to go back to caveman days? Because I do notice the quote in the book, "It's hard not to conclude that our entire physiology was engineered to reward us for moving." Why would that be?
Yeah, so anthropologists and psychologists think that the way that human beings have survived for hundreds of thousands of years is we have to be willing to do difficult things physically to survive. And so our brain has found a way to reward us for that. And when we engage in life using our bodies, whether it's to, in the old times, gather food or cooperate, that our brains actually reward us for that. And not just our brains, but also our muscles and every aspect, every system of the body rewards us, not for doing exercise to make it healthy, but because when we are active, that's how our brains and our bodies know we are engaged with life. And so you can just think of it as every system of the body. It reads movement, whether you're going for a walk or you're gardening or you're playing with your kids or you're lifting weights or you're doing yoga. Your brain simply reads that as, I am engaged in life. I am doing something that matters. If it's difficult, your body and brain will reward you by giving you energy. If you are experiencing challenges, your body and brain reward you with brain chemicals that give you optimism and hope. If you're moving with other people, your brain rewards you with chemicals that makes it easier to bond with the people that you're moving with. And again, it's not so much about, can you get your heart rate into a specific zone? Or are you doing a particular exercise with the right form? It really is about movement. And so anything that gets your heart rate up a little bit, or that deepens your breathing, or that uses whatever parts of your body still move, you're going to get some of the benefits we're talking about.
Well, let's talk about one of the most popular forms of reward for exercise, and that's the so-called runner's high, which you do a chapter on in the book. I think it's the first chapter in the book. There's going to be people watching this right now saying, yeah, I've heard of the runner's high, but come on, does it really exist? So tell us, does it really exist?
It does exist. And I'm also here to say you don't need to run to get it. So I'm personally not a runner, although I love runners. I'm married to one. You can get an exercise high through any form of movement that basically just keeps you in motion for at least 20 minutes. And the runner's high or the exercise high, it's a change in brain chemistry that really is the classic reward for being engaged in life through your body. And many people think that it actually is endorphins, but the primary brain chemical that's released when you exercise for about 20 minutes, you're active for at least 20 minutes, it's endocannabinoids. And those are the brain chemicals that cannabis mimics. And when your brain releases endocannabinoids when you exercise, one of the first things you'll notice is you feel less stressed, less worried. There's a sense of ease or peace. Your mind quiets down. You also feel more energy. You feel more powerful. Movement gets easier. It's one of the reasons why sometimes the second half of a workout feels better than the first. Even though you should be tired, you're actually energized by this exercise high. And then the thing that I think is so fascinating about the exercise high is that endocannabinoids enhance pleasure, and particularly social pleasure. So it's why so many people might say go for a walk or a run or go to the gym and come back and feel like it's easier to connect with their family. Sometimes I heard from so many people who would say their family sends them out for a run when they're not, the best version of themselves, because they know they'll come back, really able to connect. And it's one of the reasons why exercise is also such a powerful antidote to loneliness and even things like social anxiety and depression. Because in all of those cases, even with things like grief, one of the reasons why those things are so difficult is it makes it harder to anticipate and experience social joys and connection. And exercise is one of the few things we know that actually creates the brain chemistry that makes you more open to connecting with others and able to overcome that anxiety or to actually experience those moments of joy that come from being with others. And, during COVID-19, when so many people are feeling more isolated, exercise is one of the ways to really to draw out whatever pleasure and connection we are able to find.
I'm trying to see whether I remember this properly from the book, though. You are more likely to experience a runner's high, not if you walk, not if you sprint, but if you jog. Is that right?
Yeah. Yeah, it's this interesting thing. So one thing I'll say is there's no one recipe for getting like your ideal exercise benefit, movement benefit. It does seem that if what you're looking for is that classic exercise high where you feel less stressed, you feel empowered, and you're getting that burst of endocannabinoids, moderate intensity movement is most likely to provoke it reliably. And again, it has something to do with this idea that moderate intensity has a lot to do with how human beings survive and thrive with life. It's not you're pushing yourself to your absolute limit, and it's also not really casual. It's alive and it's vital. And so, if you don't know what moderate intensity is, it's basically, do you feel pretty good, like you could keep going, but you also sense that your heart rate is up or you're sweating a little bit. You feel a sense of effort, but it's not all you can do to just keep going the next second. That's the classic exercise high. But let me tell you, if you want more brain chemicals associated with joy and connection and resilience, there are other things you can do that amp up that brain chemistry even more. So rather than focus on intensity, you can add music. You can move with other people. You can exercise outdoors in an environment that inspires you. There are a lot of other ways to really bring out the pleasure and the brain benefits of movement.
Well, if I recall, one of the people you talked to for the book described it as having had a couple of Red Bulls with vodka and a $50 lottery ticket in their pocket. Like it was that kind of high as opposed to smoking a marijuana joint and kind of having a chilled out high. Is that right?
Yeah, so one of the most reliable effects of movement, if you're doing a movement that's safe for your body, that really, that you are choosing to do because it has some sense of purpose or pleasure, people end up feeling energized and more optimistic. And it's not only just happiness. So I included that because I thought it was kind of funny because so many people compare an exercise high to other substances. But my favorite definitions of the runner's high are the ones I included where people say things like, I feel connected to everyone in my life, and I even feel a little bit in love with the strangers that I walk by. Or I feel like I could take on the world, and all of the challenges in my life feel so much more approachable, like I'm ready for this. Those aspects of the runner's high, I think, are more compelling than the shot of Red Bull or whatever. It's that it's not just feeling good. It's feeling good about yourself and good about the world around you. And that's really powerful.
Is it addictive?
It can be. So, there are a couple of ways to think about exercise addiction. There is an unhealthy version of it that functions like a destructive addiction that's almost always linked to things like eating disorders, body dysmorphia, people who are using exercise to try to control their fears around what their body looks like. It's one of the reasons why I actually don't think about exercise from the point of view of trying to lose weight or fix your body. I'm really focused on how movement can help us experience things like joy and meaning and courage and hope. So leaving aside that it is possible to develop an unhealthy dependence or addiction that's often wrapped around other kinds of suffering, most people get addicted in a really positive way. And we know that if you're somebody who is regularly active and then you are forced to be sedentary for a day or two, you will start to feel symptoms of things like depression and anxiety that look a lot like withdrawal, because exercise has such a profound effect on our mood and our outlook that when you don't do it, you will notice it. And many people develop this kind of healthy dependence on movement where it's like a committed relationship. You're almost in love, and then you just commit because you start to see what an important role it plays in your life. And so that's the way I like to describe it. But the thing so here's what I want people to know who maybe have not yet fallen in love. Research shows that it takes about 6 weeks for the brain to really reward you for movement if you have not been active. So with regular exercise, your brain changes how it experiences everything from the physical sensations of movement, like how does your brain interpret signals of effort and your heart rate going up? Is that aversive or is it pleasurable? Your brain changes in terms of how many of those happy chemicals it produces and how strong your exercise high is. Your brain changes in all sorts of ways that allow you to experience more pleasure, more meaning, and less discomfort when you move. So a lot of people have to get through those first 6 weeks or so by finding other ways to experience pleasure or pride in what they're doing. And I really want people to know, if you think you hate movement, you might need to just find the form that works for you right now in your life and to trust the process of change. Because we all know that when you exercise, your muscles change, and that takes time. We know that your heart changes. Your heart gets stronger when you exercise, but it takes time. And the same is true with your brain. But what most people don't understand is that the way your brain changes when you exercise is your brain actually learns to enjoy it more, to actually want it. And your brain changes in other ways that make you more resilient to stress and more sensitive to all forms of joy. Exercise is one of the only things we know that has this effect on your brain. And it's one of the reasons why it's worth committing, even if right now you think that you aren't an exercise person.
Kelly, I have a bit of an odd follow-up for you on that, and that is, I am told that when some people are addicted to illegal drugs, or what once upon a time might have been illegal drugs, if they even so much as see drug paraphernalia, they can start to get an intense craving for that feeling again. And I wonder if the same thing happens for exercise enthusiasts who are hooked on that high that we've been talking about. And if they see, I don't know, a tennis ball or a, or a baseball bat on the ground or a running shoe, does the same thing happen?
Yeah, so this is such an interesting thing. So again, this is not going to make any sense to people who haven't fallen in love with exercise yet. But one of the things I discovered in the research is there's something called a pleasure gloss, which is when you experience deep joy or meaning or pleasure in the context of some cue, an object or a sound or a smell, your brain starts to interpret that smell or object or sound as inherently good and pleasurable. And it turns out that the same thing happens with exercise, that, a runner can look at shoes that they have run a number of races in and actually get this rush of happy chemicals, a rush of pride and joy that is similar to some of the more destructive things that you see in addiction. And the reason I think this concept is so interesting is it also is a lot like what happens if, say, your child lives in another part of the world and you look at their photograph or you get a text message from them and you get that immediate burst of joy. It's the same thing that happens when somebody who loves tennis hears the sound of a can of tennis balls being opened. And what I love about that is, like, we're not trying to get everyone addicted to exercise, but there's something really powerful. I mean, we don't attach these kinds of pleasure glosses. Our brain doesn't learn these powerful associations to things that aren't like truly embedded in our human capacity to form strong attachments to things. And so I think of it, I really like the analogy of falling in love or attachments, like human attachments, even more than addiction, because we know that addiction has all of these negative consequences that exercise has the opposite effect of. So, for example, if you become addicted to a substance, what often happens in your brain is that you lose the ability to take joy from other things like food or a sunset or human interaction or pursuing a goal. Your brain actually starts to inhibit the capacity for joy for anything other than what you're addicted to. And as I said, exercise does exactly the opposite, in part because the way that exercise releases brain chemicals, it's the same chemicals as a substance of abuse, but at a level that is so healthy, it doesn't tell your brain, whoa, you need to adapt to this and suppress joy. It says, oh, I guess we're engaged with life. Let me change my brain structure and function so that I can experience more hope and motivation and joy and connection.
Although there is a bit of a paradox here, and I'll turn your attention to gyms. When they're open, which of course they're not here, and I guess where you are as well, when they're open, you see people going to try to achieve all of the things that you've just referred to, and many of them put their earbuds in and shut out the rest of the world. It's a very solitary thing. Having said that, you say doing it can enhance social cooperation. So you got to explain all that to us.
Okay, well, first of all, let me say there is nothing wrong with putting your earbuds in and using music. So music amplifies all of the benefits of movement. And if you need some me time, especially if don't go to the gym, you're at home alone, you should also know that movement enhances the pleasure of music. So when you put on a song that makes you feel powerful or that reminds you of a good time in your life, it releases adrenaline and dopamine and endorphins, and movement enhances that. So again, especially if you think you're somebody who doesn't like any form of exercise, start with your playlist rather than the form of movement you're going to force yourself to do. And that playlist will often really pull out your ability to persist. So that's why people are putting in their earbuds if they're on their treadmill. So that being said, there is a lot of benefit to moving with other people. And we know that when you move physically with other people for any purpose, it doesn't have to be like at the gym. You could be building something, or you could be cooking together, or you could be dancing at a wedding. And we know that actually we have an instinct to bond and to trust with people that we are moving physically in sync with. And so it's one of the reasons why if you do go to a yoga class or you go to a dance party and you're moving with other people, we are built to feel like we can trust people that we're moving in sync with. And so, there's all sorts of interesting studies that say, like, after a yoga class, if people are given a chance to cooperate or to do something to support the greater good of their community, they're more likely to do it than if they only did a movement practice on their own. So there is something particularly special about moving with other people that pulls out our pro-social nature.
Well, let me follow up on the dance angle, because you've got a story in the book about a 75-year-old grandmother of 9. Her name's Miriam. She's got Parkinson's. What does dancing do for her?
Yeah, so, not just her, but so many of the people that I met at this program called Dance for PD, people who have different stages of Parkinson's disease and who are invited to reconnect to the joy of music and movement and community through these wonderful dance classes. And one of the things that, so One of the things that is most insidious about Parkinson's disease is it doesn't only impair physical movement like walking or dancing, but everything that is a physical movement, including facial expressions and your ability to reach out and take someone's hand or give them a hug. So one of the really interesting things about Dance for PD is because it uses music, and music actually invites the brain's motor system to become more activated, to become more engaged in a way that allows people with Parkinson's disease to actually physically do things that they could not do without the benefit of music. And so dance in particular, it allows people to transcend some of the limitations of Parkinson's disease, to move in ways that are beautiful, to re-experience themselves as capable in their bodies, and by the end of a class, to be able to connect with one another by, taking hands and offering hugs and expressing emotions. And I talked to a lot of people in that class for whom it was different than something like physical therapy. Physical therapy is really important for a lot of issues, but there's something about dance that allowed them to feel less defined or trapped by the limitations of their disease. And I saw this not just in Dance for PD, but a lot of the communities that I went to where people were struggling with what we could call real barriers to movement, whether it's something like physical disabilities, being in a wheelchair, surviving a stroke, or suffering from severe depression or grief, that they found a form of movement that allowed them to connect to who they were at their best. That's the woman that I talked to for Dance for PD. She had always loved music, and Dance for PD gave that love back to her. But I also, I feature a woman who, after becoming partially paralyzed and living in a wheelchair, discovered boxing, and a whole side of her that she sensed herself as strong and as a fighter, similar to how I experienced boxing. A woman who was grieving the loss of her child, who found connection to her child by spending time in nature running, that she discovered that there was something about exercising outdoors that allowed her to feel a deeper connection to her son than she could in any other environment or any other time. And I really think that that's what's so amazing about movement. And again, why we're not just saying, get your heart rate in this zone, go do this number of squats. We're talking about movement and allowing movement to bring out natural human capacities to experience things like joy or community or hope.
Well, one of the things that I think many people have discovered during the COVID-19 pandemic is that they can't go to the gym like they used to. They may not have a Peloton in their basement. And I find when I go on Twitter and you put in the hashtag morning walk, there are just wonderful stories and wonderful pictures of what people have discovered just getting out for a walk. How much of a difference does it make to your life if you can even go out for a half-hour walk among nature every day?
Absolutely. So there's something very powerful about moving outdoors. We know that it can improve mood faster than almost any other form of exercise. There's something about being in nature, in an environment where you feel safe, that immediately changes what's happening in your brain in ways that look very similar to what happens when people meditate. There is a kind of spontaneous mindfulness, a spontaneous sense of perspective on life that is one of the reasons why I think exercising outdoors has been so popular during COVID-19. There's studies showing, for example, if you go for a walk in nature and you're asked to think about the biggest problem in your life, an unresolved issue, you feel more optimistic about the possibility of overcoming that obstacle or resolving that problem. There's something about being in nature that makes us have a hopeful and bigger perspective on our lives and helps us feel connected to something bigger than ourselves. And I really encourage people to think about doing this in all weather that is safe and that works for you. There are some real benefits to exercising in the cold. Also, just the psychological aspect of it. So many people have said to me that actually they feel most alive when they're out there exercising in the cold because they sense themselves as committed and as connected to the cycle of life. So it doesn't have to be only when it's, perfectly sunny and easy to be out.
Well, this has been a perfectly encouraging and wonderful journey over the last half hour that we've spoken. So needless to say, I have to ask a real nasty high-type fastball for the last question here, which is there's so much about life today that conspires to prevent you from moving, right? Most of our jobs, look at the job we're doing right now. This is probably the longest you and I are going to be stationary all day long. We've been sitting here for the last half hour. But there are so many jobs, particularly now during the pandemic, where people don't move. Is there too big a mismatch between what we need to lead better lives and what the reality of our lives in modern society is today?
Well, it definitely is true that our environment is conspiring against us. And many of the things that we have to do in our lives are keeping us from being as physically engaged as maybe humans were 100,000 years ago. But I think that what's important to remember is that if you aren't active now, every small dose that you add, we know from research, can enhance your happiness. Even things like how many steps you take per day is linked to meaning in life. And so whatever your baseline is, rather than worry, is it short of ideal? Know that increasing from your baseline, the research is very clear. There's no dose too small to make a positive difference in your happiness and your mental health. So I would encourage people to look around their lives and figure out what is the easiest way to begin. And I will tell you my favorite way to begin is pick a favorite song, can be as short as a couple of minutes long, put it on and do any kind of movement that you find enjoyable or meaningful, whether it's yoga poses or dancing or push-ups or just walking. And I'm telling you, you will get a real benefit from that.
Great advice. The Joy of Movement is Kelly McGonigal's latest. We highly recommend it. And I do have to say as well, the joy of being stationary over the last half hour has been pretty good as well. Dr. McGonigal, it's been great to have you on TVO again. I hope we get to see you in Toronto next time you get a new book out.
Definitely. Thank you so much.
And that is the agenda for Thursday, December 10th, 2020. Every day, Ontario reports the numbers for new COVID-19 cases. Tomorrow, we'll learn more about what it means to be one of those cases, particularly for those referred to as long haulers who deal with lingering effects of the disease. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.